Assalamualaikum everyone and a very warm welcome to all of you in Pakistan Cardi Super League Season 2 powered by Wilson's Pharmaceuticals. Today we are thrilled to bring you the live action of a third match between L.N.H Pelicans and H.M.C Stallions. Before diving into the excitement of the match, allow me to introduce the senior faculty members who have joined us today, who have graced us today with their presence. Today we have with us Professor Mohammad Isaac. Professor Mohammad Isaac is a distinguished cardiologist and he will be today match umpire and he will be joining us all the way from the UK. Another important member is also with us from the governing council of Pakistan Cardiac Super League. We have with us the immediate past president of Pakistan Cardiac Society, Professor Javed Akbar Syal. Professor Javed Akbar Syal is also a professor of cardiology and executive director at Sindh Institute of Cardiovascular Disease, Karachi. And another governing council member, a very renowned interventional cardiologist, Dr. Jabbar Ali, has also joined us today. He is assistant professor of cardiology at Lady Ring Hospital, Peshawar. And last but not the least, moderator of today's program is Dr. Hamza Gauri. Dr. Hamza Gauri is serving as assistant professor of cardiology at Rawalpindi Institute of Cardiology. And without further ado, I will now request Dr. Hamza Gauri to please start the proceeding of today's third match between L.N.H Pelicans and H.M.C Stallions. So over to Dr. Hamza Gauri.
Thank you very much, Hamza, for a lovely introduction. I think it's again great to be back today for the third match of the second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and Wilson's Pharmaceutical. So we all know the matches are on and it's getting pretty tough. And today we have two teams. We have Hayatabad Medical Complex Stallions. Yes, they've been a part of the first season as well. And this time we have another team, the newcomers, which are L.N.H National Hospital Pelicans. So I believe the match is going to be pretty interesting. It's going to be a tough fight like always. With this, I also would like to welcome our esteemed panel, Professor Javed Akbar Syal Saab. Welcome, sir. We have Professor Jabbar with us. It's great to have you as well. And our umpire for today's game, Professor Mohammad Isaac Saab. I think none of this is possible without the umpires, and sir is always there to guide us and support the teams. So today we'll start with the two teams, and I will request both the teams and their captains to give the introductions one by one, and I request the captain of L.N.H National Hospital Pelicans to give the introduction of your team, please.
Assalamu alaikum. I am Dr. Tibba Usama from L.N.H National Hospital. Achha. And I have three members. Here she's Dr. Faryal and Dr. Sadia and Dr. Shafaq.
That's great. So best of luck for today's match. I hope you'll give a tough time to the Stallions. So H.M.C Stallions, introductions please.
Assalamu alaikum, my name is Dr. Ejaz and we are representing H.M.C. Hyderabad Medical Complex as H.M.C. Stallions. On my left is Dr. Inam, Dr. Qasim and Dr. Ilyas. Thank you.
Thank you very much and best of luck. So with this we move to the next phase, and that is going to be the electronic coin toss. So can we have, yes, we have the coin toss, so it's going to be heads and tails. So I will ask one of the teams randomly. So I think we'll give the chance to the Pelicans to call either heads or tails. Pelicans.
Heads.
Heads it is. Please roll the coin.
Heads.
And it's heads. So well done. It's a great start. So you may be underdogs today, but I think it's a wonderful start. So I'm going to give you two options to keep things even Steven, so both the teams have got equal chances. So first is, do you want to take the questions or you want to throw the questions?
We will take the questions.
Okay, so Pelicans want to take the questions. And with this, I'm going to give you another opportunity to select the case. Either it's case A or case B.
Case A.
So Pelicans have chosen case A. All right, so we have the scenario on the screen. So I would now request the H.M.C. Stallions to read the question, the scenario, please.
A 65 years old lady, known case of insulin dependent diabetes of 12 years duration, hypertension of 10-year duration, paroxysmal AFib, and history of chewing tobacco. Presented to OPD with complaints of off and on chest pain, aggravated by exertion. The patient states that the episodes usually last 5 minutes and more common in the winters. She performs all her routine activities without limitation and can climb 2 flights of stairs. On examination, her heart rate is 100 beats per minute, regular, blood pressure is 130 by 70, the rest of the examination is unremarkable. Her medication include intermediate-acting insulins, losartan, atenolol, aspirin, and omeprazole. Her baseline ECG is normal. Echo shows preserved ejection fraction.
Okay, so do you want to take more time to go through the Vinaya, or should we move to the questions? Pelicans? You want more time?
Yeah.
So I believe, can we now move on? Pelicans, are we good? Okay, so I think in the interest of time, we'll now move to the first question, please. So, please read the question, Stallions.
Question number 1, what is the pre-test probability of underlying coronary artery disease in this patient? The 5 options are there, A, B, C, D, and E. Option A, very low, B, low, C, intermediate, D, high, E, very high.
Okay, so your timer, 60 seconds, start now. As Ishaq Saab always says, take your time, don't be hasty. And you can take the scenario,
It's
you can
C.
okay, so are you sure? You still have time?
Yes.
You want us to lock option C?
Yes. Lock the option
Option C, intermediate. So please lock the option. And yes, well done. So you start off with a 6. Very good. I think that's a good flick over the square for a wonderful 6. Good start.
Brilliant start. Very brilliant start. Good luck.
Thank you very much, sir. I think this is what they need. So moving on to question number 2. Please read the question.
Patient is advised an exercise tolerance test on treadmill. Which of her medication should be considered to be tapered prior to ETT? Option A, atenolol, B, losartan, C, insulin, D, omeprazole, E, aspirin.
It's A.
Okay, so I would
Atenolol.
also like to welcome Professor Dr. Mahmoodul Hassan. He is the president of Pakistan Cardiac Society. Welcome, sir. So yes, so that's pretty quick. Are you sure? Which option?
Yes. A. Atenolol.
Atenolol. Should I lock it?
Yes.
Okay, so they are adamant. Lock option A, atenolol. Very well played. Another 6. Okay, we are in for a big score, I guess. Well done. So question number 3 on your screen. Please read the question.
Question number 3, how long prior to the ETT should the patient taper atenolol? Option A is 1 day, option B 2 days, option C 1 week, option D 2 weeks, option E 5 days.
And your timer starts now.
It's A, 1 day.
Okay. Are you sure?
Yes.
And you want me to lock it? Lock
Yes.
the option then. It's option A. Lock it, please. Oh, so that turns out to be a quick bouncer. Okay, that's all right. You still have.
Hamza, again, they didn't observe my instruction. Consume the full time. 50
Yes,
seconds से पहले आपने नहीं बोलना.
very right, sir. I think you should make the most of the time that is given to you, and Ishaq Saab is always right on this account. So I think you need to be more focused, utilize your time. So moving on to question number 4. Stallions, please go ahead and read the question.
Question number 4. The patient undergoes ETT. She exercises for 10 minutes with mild chest pain. Her ECG shows no STD changes during the exercise. What is her DTS score? Option A 4, option B 6, option C 5, option D 7, option E 8.
Timer starts now.
Hmm.
15 seconds left. 10 seconds. Come on. Answer.
It's E.
Okay,
E
lock
for
option E. Oh, well, that turns out to be another quicker one for you. Never mind. I think it was a good start. So you've taken your time. I'm hoping that the next one is going to be different. And question number 5 on your screen, please.
Question number 5. Based upon the patient's pretest probability and ETT results, what is the next best investigation? Option A, invasive coronary angiogram. Option B, CT coronary angiogram. Option C, dobutamine stress echocardiogram. Option D, calcium score only. Option E, none of the above.
And 60 seconds on your screen. Come on, Pelicans, you can play it well.
बताओ
20 seconds.
कोई ऐसे
10 seconds.
It's D.
Okay.
D.
Are you sure? D for doctor?
Delta.
Delta.
D. Delta.
Good.
Yes.
Good. So lock D. D for Delta. Calcium score only, that is. Oh. Well. And I thought it was an easy delivery. But turns out we've missed it. So never mind. So we've got 3 dots on the trot now. So next question on your screen, please. Question number 6.
Question number 6. A decision is made to proceed with CT coronary angiogram. However, it could not be proceeded as the calcium score was 975 Ag. Based on the calcium score, what is the patient's pretest probability of underlying coronary artery disease? Option A, minimal. Option B, low. Option C, intermediate. Option D, high. Option E, none of the above.
60 seconds on your screen. Come on, Pelicans. You need to focus.
हमें दोबारा हाँ it could not be processed here.
Approaching 20 seconds.
It's D, delta.
Are you sure you want me to lock it? Should I lock it?
Yes.
Okay, D, delta.
Yes.
Yes, well done. Well played. Another 6. This one over the covers, and I really love it. So, next question, question number 7. On your screen, please. Stallions, read it.
Question number 7. A decision is made to proceed with invasive angiogram after informed consent, which shows 60 to 70% proximal LAD disease and muscle bridge in distal LAD, with 70 to 80% systolic squeeze, 70% disease in distal circumflex, non-dominant small caliber vessel, and 70% disease in one of the branches of PLV, small caliber vessel. What should be the next step? Option A, PCI to LAD. Option B, medical therapy. Option C, FFR to LAD. Option D, QFR to LAD. Option E, cardiac surgery opinion for cabbage plus deroofing of muscle bridge.
And 60 seconds start now.
नहीं लेकिन देखो यहाँ वैसा डिजीज आ रही है तो वैसा डिजीज आ रही है उसमें भी 60 to 70 उसमें FFR करना चाहिए प्लीज शेयर द स्क्रीन ये नजर नहीं आ रहा
Okay, please share the screen. They can't see it. Okay, I think we are working on that. Please put the screen back. Can you see it now? Pelicans, can you see it? Okay. But you've got 15 seconds now.
but it's not clear
What's not clear?
it's not clearly visible
Okay, hold it. I think we'll have to give them because they can't see it. Hold it. I think we'll give you the space and the time that you require for it. So, can I have the technical team fix it, please? So, we apologize for this technical glitch. I think the team is working on it. Okay, so do we have it back? Okay, so
yeah
you can see it now? Okay, the
Yeah,
timer
we can
starts
see.
okay from 30. Yes, please go ahead.
सिस्टोलिक इसमें भी आ रही है 70% के लिए FFR to LAD लेकिन मेरे ख्याल में सिम होना चाहिए
Pelicans,
वो कहना सिस्टोलिक में 70
answer.
बताओ इट्स सी कैट
Okay, so I think they want me to lock C. C for
Yes.
cat. Okay, lock C. Oh, that was very well done. I thought this was going to be difficult for you, and I was not expecting you to play it like this out of the park. So, well done. We did have a technical glitch, but I think in the end they were able to play it well. Can we have the next question? Question number 8.
Question number 8. FFR to LAD is planned for the patient. Which of the following can lead to false negative result? Option A, acute coronary syndrome. Option B, air bubbles. Option C, using side hole catheters. Option D, option A and C. Option E, option B and C.
Okay, timer starts now.
देखो ए तो नहीं होगा ए सी शायद एक इसमें ये जो रीजन आएगा पॉजिटिव नेगेटिव का क्या है इसका सी सी लग रहा है
मैंने भी डाला है उसे।
ए सी पैसा ना पॉजिटिव आएगा अगर आना नहीं होगा नेगेटिव तो नहीं आपको दूर से लग रहा है
20 seconds.
वो फ्लो रिस्ट्रिक्ट हो जाएगा क्योंकि ना एक कैसे आ रही है
10 seconds. Come on, Pelicans, hurry up.
It's E.
Option E. So they want us to
Elephant.
lock option E, please. Oh, it turns out to be a googly for you. I guess you were close to it, but well tried in the end. So with this, we move to the next question. Question number 9 on your screen.
Question number 9. In which of the following trials FFR-guided PCI did not meet its hypothesized non-inferiority criteria in comparison to cabbage in reducing mess? Option A, FAM1. Option B, FAM2. Option C, FAM3. Option D, full reverse. Option E, all of the above.
And 60 seconds on your screen. Okay. So I would also request everyone except for the teams to kindly keep your mics on mute so that we cannot get any crosstalk. The teams can keep the mics on. So 20 seconds. 10 seconds. Pelicans, come on.
It's D, delta.
Okay, so they want us to lock option D, full revask. Option D, lock it please. Oh, again, you were very close to it, but in the end, I think the delivery took the better of you. So, well, we move to the next question now. So this probably is the last chance to put up a good score. Come on, Pelicans. Please read the question 10.
Question number 10. FFR to LED was done, which came out to be
It's not
0.7.
clear.
Okay, so hold it
Excuse me.
please.
It's not clear again.
The slide is not clear. I think we'll wait till it becomes clearer. Technical team, please look into it. I think we may have some issue with the internet there. So the team is working on it. Is it clear yet, Pelicans? Can you see it? Pelicans, can you see the question?
They are discussing it, but they don't see it.
Okay, Pelicans, can you hear me?
Sir, we can hear you.
Okay, so Pelicans, can you hear me? Stallions can hear me.
Yes.
Okay, Pelicans, then can you read the
Yes.
question? Can you read the question? आपको सवाल नजर आ रहा है Pelicans?
Yes. But its screen is small.
सर मैं रिक्वेस्ट करूंगा कि
not clear again.
पार्टिसिपेंट हैं वो पिन कर दें पाकिस्तान कार्डिक सुपर लीग को जूम के अंदर, तो वो स्क्रीन बड़ी हो जाएगी.
Okay, so I think they are working on it. Yes, I would request the technical team to assist both the sides.
कंट्रोल डिफेंस पे एंटी का प्ले दोनों सेम ही है वो 12 मैच का ही है लेकिन शुरू में ट्रिपल ही होती है
So I think the Pelicans, they'll have to pin the window from their end. Can you do it? L.N.H Pelicans, you'll have to pin the window. Can you do it?
इशू है वो करेंगे वो उनके साथ इशू है वो
Do they have somebody there who can guide them on ground?
यस
Okay, so I think they should do it. I think they're having some.
जूम में जो पाकिस्तान कार्डिक सुपर लीग की विंडो आ रही है उसको आप पिन कर देंगे तो वो मैक्सिमाइज हो जाएगी प्लीज। तो आपको क्वेश्चन नजर नहीं आ रहा जो क्वेश्चन नंबर 10
Okay, so
है?
what I can do is I can, if they are having this issue, I'll read the question. So you just hear me out, right?
ओके
Okay, so I think I'm going to read the question number 10. Here it starts. FFR to LAD was done, which came out to be 0.78, followed by PCI to LAD with a 2.75 into 18 mm DES drug eluting stent. How will you manage the patient's antithrombotic regimen post PCI? Option A, dual antiplatelet therapy for 12 months. Option B, dual antiplatelet therapy for 6 months. Option C, triple antithrombotic therapy for 1 week followed by dual antithrombotic therapy for 1 year. Option D, triple antithrombotic therapy for 1 month followed by dual antithrombotic therapy for 1 year. And option E, triple antithrombotic therapy for 6 months. The timer starts now, 60 seconds.
इट्स डी डेल्टा
Are you sure you want me to lock it?
यस
Sure? Okay.
यस
So option
ऑप्शन डी
Option D, lock option D, please. Oh. So yeah, again I thought this was it became a bit tricky in the end. So I would say well done Pelicans, your first game. So I think it's going to be a reasonable total, and I'm sure Stallions are also up for it. Here it is. So total score is 24. So it's with 4 correct answers. So well played and best of luck to both the teams. So with this I request our worthy umpire, Professor Ishaq Saab. Sir, are you there? Can we have your word on it?
I'm very much there. Can you hear me?
We can hear you, sir.
Yes, very interesting start, and but then there are few wrong questions. But as you said, this is their first match, so they must be learning. I think the question I have reviewed this question, and it was quite a standard question with reasonable options. But anyhow, the match is match. The competition is always going to be tough. But they played well, and we wish them good luck. The next team. So with your moderation and other colleagues around, I think we are enjoying the season. So go ahead, please, with the next.
Thank you very much,
We
sir.
can
I
have the
think,
comments at the end. Total, yeah.
sir, your input is always important. I'll ask our worthy panel to give their input as they are switching the internet at the moment, since they were having some technical issue in Karachi. So I would now request Professor Jabbar, if he's there, we can have a quick word from him. Or Professor Akbar Javed Syal Saab, sir, if you're there and we can have your input also.
थैंक यू वेरी मच डेफिनेटली एक साल से तो मैं भी इसी में हूँ उससे ज़्यादा ही हो गया है तो आई एंजॉय लॉट एंड रिफ्रेशिंग माय नॉलेज एज वेल कभी कभी हम जो सोचते हैं वो नहीं होता फिर हमें समझ में आती है कि बाकी हमारी अपनी नॉलेज को भी रिफ्रेश होना चाहिए तो ये बच्चे बहुत मेहनत कर रहे हैं और हर वीकेंड अब बड़ा इंटरेस्ट गुजर रहा है और अनफॉर्चुनेटली LNH वालों का आई डोंट नो कि वो किस तरह परफॉर्म करते हैं। अगर उन्होंने सवाल मुश्किल बनाए होंगे तो उनको मुश्किल होगी, लेकिन एज प्रोफेसर एसाद सेड कि गेम इज गेम, और एट द एंड ऑफ द डे वन इज विनर वन इज लूजर, बट आई थिंक दे ऑल आर विनर। तो अभी तो खैर और भी पूल के मैचेस हैं, लेट्स हैव बेस्ट ऑफ लक फॉर देयर फ्यूचर गेम्स।
Thank you very much, sir. Thank you very much, sir. I think you're absolutely right. What matters in the end is the competition that we have. So, are we now ready with the second innings?
Hamza, just one quick
Sir,
comment.
please. Sure,
For
sir.
the benefit of my colleagues, distinguished colleagues. Some of the answers I thought were not correct according to our understanding. But then when we went with references, because all these questions are supported by references, so then we are bound to follow the references, you see. So therefore, Javed may find some question which we thought was correct and was not correct at the end. It's only because the references have, you see, supported the right answer. So I think, as you said, we are learning too.
Yes, sir. I think very right. It's a very important comment because everything has a background and it's properly referenced. So whatever you have, it's backed up by guidelines and references, and it's been reviewed as well. At times we think that you may think that the answer is right, but then you may have two answers pretty close to each other, and then you have upcoming research and guidelines which is always backed up by a lot of data. So I think I'm waiting for the go ahead from the technical side. If anybody else would like to chip in and have a word, and so I think we are now ready. We are now ready with the team. So we are okay. So we move to the second innings now. So are the two teams ready? All right. So
Yes.
can we have the scenario on your screen? Very good. So I would now request the Pelicans to please read the Vinay.
A 78-year-old gentleman, known case of diabetes and hypertension, presented with complaint of syncope preceded by exertional chest pain 2 hours ago. On examination, the patient has a pulse of 80 beats per minute. His blood pressure is 154 by 110. Chest examination reveals bilateral equal air entry, while cardiac auscultation reveals the grade 3 by 6 systolic murmur at right upper sternal edge. ECG shows sinus rhythm with generalized T-wave inversions.
All right, so Stallions, you can take a moment and then we'll move. All right, Stallions, are you ready?
Yes.
Okay, can we have question number 1 on the screen, please? And read it, please, Pelicans.
What is the next? Okay. What is the next best test that should be carried out? A. Chest X-ray. B. is 2D echo. C. HS-TROP-I. D. HS-TROP-T. And E. is CKMB.
And timer starts now. And Stallions, just 24 to beat. Need 5 correct answers.
We'll go with option B. Beta.
Okay, so 15 seconds to go now. Option? Yes?
Option B.
Option B. You mean 2D echo?
Yes. Yes.
Okay, lock option B, please. Oh, that's okay. Oopsie dozy. So you missed this one. Anyhow, moving on to question number 2. I think we may have a good start there. Question 2. On your screen.
The patient under Okay. The patient undergoes serial troponin measurements, which are normal. What should be the next best step in the management? A. Discharge. B. Discharge and follow-up in OPD. C is 2D echo. D. 24-hour halter. E is cardiac CT.
Okay, so the timer starts now, and I will request HMC Stallions to discuss it either in Urdu or English so that we can all understand what's going on.
Make sure you bring down shape. First step down, next best step.
Twenty seconds left. 10 seconds. Come on, Stallions.
Sir, lock option C, 2D echo.
So they want to lock option C. Lock it, please. And yes, Stallions are on the board. Well played. Great stroke, 6 out of the park. I think it was a beautiful straight drive. Well done. So question number 3 on your screen. Please read the question, Pelicans. Pelicans, are you there? Please read the question. Okay, I think they are disconnected, so I'm 60%. Concentric LVH.
Hello?
Yes, we can hear you. Please read the question quickly. Okay, so I'll continue with that. Calcified aortic valve with aortic valve area of 0.9 centimeter square by continuity equation and mean gradient of 39 millimeter of mercury. What is the stage of aortic stenosis of the patient as per the recent ACC, American College of Cardiology Valvular Heart Disease guidelines? Option A is stage C, 1. Option B is stage D2, C is stage D1, D is stage D3, and E is stage C2. So timer starts now, but I believe they've already had time to take a look at it. Some technical issue, I think, over there in Karachi with the internet, so we apologize for that. 30 seconds to go. "15 seconds. Come on, Stallions."
So we will go with option C.
So they want to go with option C, stage D1, right?
Yes.
Lock it, please. Oh, so I thought it was going to be a good ramp shot, but then again, you got caught. So anyhow, better luck next time. It's getting closer. So moving on to the next one, please. Question number 4 on your screen. So Pelicans, can you read the question? Are they there?
I can't read the screen is small again.
Okay, so I'm going to do the honors then. Question 4. What is the next best step in patient's management with regards to further evaluation? Option A, dobutamine stress echo. Option B, calcium scoring. Option C, invasive hemodynamic assessment. Option D, antihypertensive medication optimization. And option E, transesophageal echo. And your timer starts now. So you can always take a look at the scenario if you want to. Twenty seconds. 10 seconds. Come on, Stallions. Answer, please.
Option number C, invasive hemodynamic assessment.
So lock option C, please. Oh, another one. That was an end ducker. Oh, right on the toes, I believe. Well, it's getting closer and closer. So can we have the next question? Question number 5. It's getting tighter. Come on, Stallions. So question number 5 on your screen. So I'm going to read it. With regards to doburamine stress echo, what is the maximum dose of doburamine that can be administered? Option A, 10 milligram per kg per minute. Option B, 10 micrograms per kg per minute. Option C, 15 micrograms per kg per minute. Option D, 20 milligrams per kg per minute. Option E, 20 micrograms per kg per minute. And your timer starts now. I'm expecting a 6 on this one somehow. My instincts, they tell me they're going to hit it out of the park.
Sir, option E, option number E, epsilon.
Okay, so you want me to lock it?
Yes, sir.
Lock option E, please. Yes, so I was right. Well played, very well done, and this is nicely played. So 6 more to the tally. This is your second correct answer. Well done, but it's getting tighter. So we do have a match on our hands. Stick to your seats. All right, next question. Question number 6 on your screen. Can the Pelicans read it? Okay, so I think I'm going to read it. With regards to the clinical examination,
I can.
you can read it?
I can read it.
Okay, read please then, quickly.
Yes. With regard to the clinical examination of the patient, what character of pulse is expected? A is pulse reference, B is pulse powers,
And E is
C is
dichrotic pulse. So timer starts now. I believe they still have this technical issue going on. So in the interest of time, we'll move on. Stallions.
powers.
Thank you, Pelicans. Thank you. So Stallions will take their time to answer now. Stallions, your timer has started. .30 seconds approaching.
Sir, option B, beta.
Okay, so they were very quick with that. A quick one. And it's been flicked off their pads. Option B, lock the option B, please. And that is a clear 6. Very well played. Well done. All right, so with this we move to question number 7. And I'm going to read it myself this time again. With regards to the pathophysiology of calcific aortic stenosis, all of the following are predisposing conditions except option A, Paget's disease, B, chronic kidney disease, C, diabetes, D, hypertension, and E, chronic liver disease. And the timer starts now. They need one more correct answer to tie the score.
Sir, option E, epsilon, chronic liver disease.
Okay, so you want us to lock option E,
Yes, sir, of course.
chronic liver disease. Option E. Lock it, please. Yes, very well played, and scores are level now. Very good, and 3 more deliveries to go, 3 more questions to go, and we move on to question number 8 on your screen. So I'm going to read it again. The patient undergoes a repeat echo after optimization of blood pressure, which shows aortic valve mean gradient of 42 millimeter of mercury. To assess the severity, a cardiac CT is advised. What is the threshold of severity in our patient? Option A, 1200 AG units. Option B, 1300 AG units. Option C, 2000 AG units. Option D, 2200 AG units. And option E, 2500 AG units. Your timer starts now.
No idea.
ده في كالسيوم سكور كالسيوم سكور severity وضعيك 500 400 كده اسكيب بروجرام في disease delta semester اللي مش 100
20 seconds. 15.
Sir, lock option A.
Are you sure?
Yes, sir, option A.
So they want us to lock option A. Let's see if this is the winning stroke or not. Option A. Oh, another twist in the tail. All right. So that means we've got 2 questions left and they just need 1 right answer. It's getting down to the wire. Question number 9 on your screen. So again, I'll read it. A diagnosis of severe symptomatic aortic stenosis with intermediate surgical risk is made. Which of the following conditions will favor TAVI over surgical AVR in our patient? Option A, porcelain aorta. Option B, low coronary ostial height. Option C, aortic dilation. Option D, small aortic annulus. And option E, subaortic calcifications. Timer starts now. It's an interesting one though.
Small aortic annulus. Wasn't ready, aortic annulus.
20 seconds left.
Sir, option number D, small aortic annulus.
10 seconds. Okay. So you want me to lock option D?
Yes, sir.
Okay, lock option D. Is it the one? Oh, I was keeping my fingers crossed for this one. And when you said option D, I knew we are going to the last question for sure. Question number 10 on your screen. We are now down to the last question, the last delivery. Let's see. On your screen, question number 10. So I'll read it again. Question 10. Regarding the TAVI valves, which of the following is a self-expanding, non-repositionable valve? A, Core Evolute. B, Core Evolute Pro. C is XT. D is Sapien. E is S3. And the timer starts now. Who is it going to be?
Promo never show. Promo was never show. As a separate thing.
I'm really getting excited. We are approaching 30 seconds.
On non-repositioning.
20 seconds. Approaching 10 seconds. Come on, Stallions. 5. Come on. Need an answer.
Option B. Option number B, sir.
B. B for ball.
Yes, sir.
Okay. Option number B. Lock the option B. Oh. So we have a tie. What a wonderful match. So we've got 24 apiece. Stallions and Pelicans. What a great game. Went down to the wire. And I think since it's a pool stage game, it's the initial stages. So we will not have any further super overs or something like that. I think what we'll have here is a draw. And we can only have this in the next stage. So since it's the league game, it's a draw. Very well played. Really excited to see the result. So with this, I now move to our esteemed umpire, Professor Ishaq Saab. Sir, your thoughts on the game?
Thank you very much. I think I'm just happy as well as disappointed because whenever there's a tie, वो हमारा काम बढ़ जाता है ना. So if the match ends in a conclusion, it's better. But I think both the teams were at par and they played very well. You'll all appreciate that the questions were not too difficult. They were average. We had much more difficult questions in the past as well. So I think on the whole, it was interesting and both teams played well. I think now that is tie, we have to find out the next step to declare who will be the winner. So I'd like to hear my colleagues also say something.
Right, sir. Great points. So I would request our panel experts, worthy panel experts, to give their comments. Do we have Professor Dr. Jabbar? Is he there? Okay, so I believe we had Professor Javed Syal Saab. Is he there?
जी जी थैंक यू
Sir.
वेरी मच. जाहिर है कि बहुत मजा आया. और इसाक साहब ने जो बात की कि हमारा काम बढ़ जाता है, तो आई थिंक जब ये जो L.N.H वाले बैठे थे वो क्या सोच रहे थे, वो डेफिनेटली एट द एंड ऑफ द डे उनकी लास्ट होप यही थी कि टाई हो जाए. तो बस इसी तरह होता है. और कल भी मैं मैच, आई वाज लुकिंग यस्टरडेज मैच जो पाकिस्तान का था आयरलैंड के साथ, तो वेरी वीक टीम फाइनल में खुद दुआ कर रहा था कि भले सुपर ओवर में चला जाए. तो ये होता है जब आप बहुत सख्त मुकाबला, कांटे का मुकाबला हो, तो दिल चाहता है कि टाई हो जाए तो भी बेहतर. एनीवे, बेस्ट ऑफ लक टू बोथ टीम्स एंड वेल डन. अल्दो मुश्किल वक्त आगे आने वाला है जब बहुत क्लोज कॉन्टेस्ट होगा, और जाहिर है हमारा काम भी बढ़ जाएगा कि we need more time, more questions and more discussion. Anyway, nice weekend this week कि हमने अपना हफ्ता जो है ना कुछ सीख के ही खत्म किया. Thank you.
Thank you very much, sir. I think extremely important comments. Right, sir? Sir.
एक बात तो क्लियर है कि बहुत दी क्वेश्चंस जो थे वो इक्वल वेट के थे. ये नहीं था कि एक बहुत आसान था दूसरा मुश्किल था. जो टीम की परफॉर्मेंस से लगता है कि क्वेश्चंस वर करेक्ट इन देयर वेट ऑन बोथ साइड्स फॉर द कंटेंट्स एवरीथिंग. और फिर मैं आपको बताऊं कि इट बिकम्स सरप्राइज फॉर अस कि एक क्वेश्चन जो हम समझते हैं डी है और वो ई निकल आता है. मगर ये कि वो जब हम रेफरेंसेस देखते हैं, जब फितवा आ जाए किसी अथॉरिटी से, किसी टेक्स्ट बुक से या किसी ऐसे फर्स्ट क्लास ऑथर से, तो देन वी हैव टू अबाइड बाय दैट आंसर. सो ये एक थोड़ी सी एम्बिग्यूटी लोगों को लगती होगी, पैनल्स को भी और एम्पायर्स को भी और स्टूडेंट्स को भी, फेलोज को भी, बट आई थिंक दिस इज एक्सेप्टेबल। एग्जाम जो होता है वो एग्जाम होता है, उसमें फिर वो वही चीज देखी जाती है जो कि सिक्का राजल वक्त होता है, जो कि ऑर्डर ऑफ द डे है, जो गाइडलाइन है, जो रेफरेंसेस हैं, और बिकॉज दे सिट फॉर द एग्जाम सो दे कीप ऑन रीडिंग, दे आर मोर अप टू डेट देन अस। सो आई थिंक दिस दिस हैज बीन ए ग्रेट, जैसे जावेद ने कहा, ये बड़ी लर्निंग एक्सपीरियंस हम सब के लिए है। और इंशाल्लाह जो नेक्स्ट मैच होगा इवन मोर इंटरेस्टिंग। सो आई थिंक आई वुड आस्क द फेलोज, डोंट लूज हार्ट, अच्छी तरह तैयारी करें। और मैं एक बार फिर कहूँगा कि जब आप आंसर करें तो 60 सेकंड आपको दिए हैं, तो आप जब ना करें, टेक योर फुल टाइम, गिव इट ए सेकंड थॉट, और आपस में कंसेंसस के साथ एक क्वेश्चन को फिर आप आंसर करें, तो मेरा ख्याल है आपके ठीक होने के चांसेस बढ़ जाएंगे। बहुत बहुत शुक्रिया एंड वेल डन हमजा, the best moderator we can imagine, and Messrs. Wilson Pharmaceuticals for this innovative academic activity which is becoming very popular in Pakistan. Thank you very much and Allah Hafiz.
Thank you very much, sir. It's always an honor to hear from you all, and as we all say, it's not the victory or the loss. It's actually the competition which makes you. And I think this is the point of the whole exercise. हम सब लोग यहाँ से सीख के जाते हैं on everyday basis. Every week we have so much to ponder upon, so much to learn, and this activity I think is a wonderful activity. It's a game changer for our fellows, and I am hoping and I'm pretty positive that we are going to make the most of it. So we had a wonderful game today. It was really exciting. I think both the teams played very well. The questions were also at par. There's a lot of effort that goes into it by the panel of experts, the reviewers, to make it happen, especially Wilson's Pharmaceutical. I think they're doing a wonderful effort on this. Their team is always on point with each and every preparation that they do. So I think hats off to the team and hats off to everyone who's affiliated with this wonderful league. So with this, we come to the end of today's match, and inshallah we'll see you in the next game. Till then, Allah Hafiz.